Congress just passed Trump's big ugly bill, and it's gonna gut Medicaid for Michiganders. And as a result of this bill, rural hospitals across Michigan are at way higher risk of closing. To explain just how devastating this is gonna be for rural hospitals across Michigan, I want you to imagine that each of these juicy strawberries, Michigan strawberries, are in fact patients who bring insurance income to every hospital. 20% of patients in rural counties like this have their insurance via Medicaid. So what would happen if Medicaid all of a sudden went away? When I put strawberries in, each of these strawberries represents a single patient. So every month, let's say this hospital gets 5 strawberries. 1, 2, 3, 4, 5. And this one, because we've lost Medicaid, only gets 4. Now let's do it every month for 12 months. This is before the big ugly bill. This is after the big ugly bill. And we know what might happen to this hospital. Even when people don't have Medicaid, they still need health care, which means they're going to the emergency room, and you know who has to pay that cost? Everyone else. That's going to raise healthcare costs on you, even if you're not a Medicaid recipient. Michigan's home to 64 rural hospitals, and 20% of them are already at risk of closing. Medicaid being gutted is just going to make that worse. What that means is hospital closures. That means longer wait times, more expensive healthcare, and worse access to healthcare if you need it. People driving 2 hours, 4 hours in the case of a heart attack or a stroke. We need leadership that's willing to fight for more healthcare, not less. That's why I believe in Medicare for All, guaranteeing healthcare for every single person without premiums, copays, or deductibles. We can, in fact, do better. We must. People are counting on us.